from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio, this is Healthcast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to Healthcast. I'm Allison Gottermeyer. Thank you for joining us today as we talk cardiac rhythm management and a new international clinical research study Sarasota Memorial has been participating in. Our guest today is Dr. Dilip Matthew, a cardiologist, electrophysiologist, and the primary investigator on the study that I just referenced here at Sarasota Memorial. Dr. Matthew, thank you so much for joining us.
Thank you.
Can you start by telling us the basic? What exactly is cardiac arrhythmia?
Cardiac arrhythmia means there is an abnormal heart rhythm. Every time we breathe, the heart pumps blood to all the organs. And that is primarily predicated by how fast or slow our heart beats. And that is dictated by a structure called the sinus node. So all of us have a sinus rhythm. Any abnormality of this sinus rhythm is what is called as cardiac arrhythmias.
And what are the warning signs of cardiac arrhythmia? And who does it impact?
It impacts almost all of us, and at least about 5 to 10% of the general population may have some form of abnormal heart rhythm. The common symptoms are people may feel lightheaded or dizzy if the heart goes very slow. If the heart goes fast, they may get a fluttering sensation or palpitations, as we call. Those are the common symptoms. But they may have some vague symptoms like fatigue, shortness of breath, feeling extremely tired, and they may be related to abnormal rhythm problems, and they need to check with their primary care physician and determine whether it's really related to a heart rhythm disturbance.
If there is that heart rhythm disturbance, how important is it that a person seek medical attention?
I think it is quite vital because our heart rhythm, as I alluded to earlier, is what dictates how good the heart pumps blood to all the organs. So I think some of them could be minor and a simple intervention may be enough. Some of them may be significant. So I think they do need to take notice of that and seek help from their primary care physician.
So you said about 5 to 10% of the population. There are factors that can increase that, though. How common is it here in Sarasota?
Very common. I would say the most common rhythm disturbance is atrial fibrillation. About 5 to 10 million Americans will have it by 2050. And knowing the demographics in Southwest Florida, we see a fair amount of patients who require treatments for atrial fibrillation as well as slow heart rhythms.
So what is the typical treatment right now for irregular heartbeats?
For irregular heartbeats, the treatment is sometimes it might be just monitoring, may not necessarily need to be on medication. But once the physician or the determines, which is a cardiologist or a cardiac electrophysiologist like me, we determine that they need some intervention. It could be in the form of medications. Some of them are called antiarrhythmic medications. If medications don't correct the problem, then you may need a catheter procedure called ablation, which is quite commonly used these days with atrial fibrillation. The other spectrum is where we use devices like pacemakers or defibrillators to correct both slow and fast heart rhythms.
So let's dive a little deeper there. What is a pacemaker?
A pacemaker is an electronic device. The traditional pacemaker is placed in the chest wall, typically on the left side. It is placed beneath the collarbone, and it has a battery and electronic circuitry on this device, and is connected to the chambers of the heart by means of wires. We call them leads. So those wires are inserted in the veins in the chest, and they traverse through the veins into the chambers of the heart. So it is not a cardiac surgery, major cardiac surgery, but it's still an invasive procedure and requires hospitalization for a day or two.
You also mentioned defibrillator. How's that different?
Defibrillator is a version of a pacemaker, slightly bigger than a pacemaker. What a defibrillator does is that if your heart goes extremely fast from a rhythm called ventricular tachycardia, then the defibrillator monitors it and if appropriate, either paces the fast rhythm out of it, or may shock the patient to get them back to the normal rhythm. And it will work as a pacemaker too. So it does pretty much all the functions of a pacemaker. In addition, it will provide therapies to correct dangerous arrhythmias like ventricular tachycardia.
So when we talk about pacemakers in the traditional way, that's different from what we're seeing now with this clinical research trial at Sarasota Memorial. So can you just tell us a little bit about it?
So the pacemakers, some of the issues have been because we have to use wires to connect to the heart. These wires are prone to wear and tear, and they may get what is known as lead fracture or lead malfunction. The other problem is that the devices are placed in the chest wall, and we create a small area called a pocket. And people who are immunocompromised or who have other major comorbidities are prone to infections. So those are the two main problems with traditional pacemakers. So some of them may not have access to the veins to guide these wires to the heart. So we have been looking at alternatives, and about a decade ago, we came up with the concept of what is known as a leadless pacemaker, wherein a pacemaker is inserted with a minimally invasive procedure through the veins in the groin and is deposited in the chamber, the bottom chamber of the heart, called the right ventricle. And there are no wires connected, and there is no pocket problems because there's nothing apparent on the chest wall. And this leadless pacemaker delivers small electrical impulses, painless electrical impulses, which will stimulate the heart. So it will do what a traditional pacemaker would do, but it will not have the problems with lead malfunction or device-related infections. So that pacemaker was, is a single-chamber pacemaker. So it will only provide electrical impulses to the bottom chamber of the heart. But we do need the function of the upper chamber as well. So in patients who require a pacing modality from the upper chamber, we were looking at alternatives, and this trial is the first globally study which is looking at these dual chamber pacemakers in a leadless fashion.
How could this be a game changer?
I think it will be because all the problems we alluded to related to infection and lead malfunction, it might be initially confined to a small subset of population. But if I had the option for any person who requiring a pacemaker, I would probably consider this as opposed to having a device placed on the chest wall. Apart from the cosmetic problems, which especially in women we have, the big issue is infection, and if we can get away with that, it would be a game changer for sure.
And with some of those complications in the traditional pacemaker, that requires more intervention, correct?
Exactly. We have to sometimes, these wires, they're attached to the heart muscle, and they're not easy to remove. So we use a procedure called lead extraction that is fraught with its own complications, and not every center is equipped to do that. Fortunately, in Sarasota Memorial Hospital, we have physicians or cardiologists and cardiac surgeons who can do that, and one of them is myself who can do that. But we try not to do them on a routine basis.
And the benefits of a minimally invasive procedure are huge, correct?
Of course. If you look at it, if you get a traditional pacemaker, they have to come to the office to have the incision checked, and then every 3-4 months they have to have the device checked. So if you have a minimally invasive procedure where nothing is apparent other than a small nick in the groin, the follow-up is less intense.
Who is working on this research trial here at Sarasota Memorial with you?
So I'm the principal investigator for our hospital. My colleague, Dr. Robert Eckert, is also a cardiac electrophysiologist. He's a co-investigator. And we have Colleen Linda, our research coordinator. She's a nurse practitioner and she's a doctor as well. She's got a PhD. She has been phenomenal in helping us coordinate the study. So we are the primary ones involved in the study here.
What is the goal of the trial and what might some potential benefits in the future be?
The goal of the trial essentially is to look at the safety and efficacy of this new device, whether it would do all the things that a traditional pacemaker would do. At the same time, we had to monitor the complications and the long-term efficacy of this device.
Has Sarasota Memorial enrolled any patients thus far?
Yes, we have. We've been fortunate. There are about 80 centers worldwide. We were one of the few centers in Florida to be involved in this study, and we have already enrolled patients in the study.
So what does the process look like for the patients enrolled in this study?
So the process is primarily they have to be evaluated by their primary care physician or cardiologist, and they have to meet the indications for requiring a pacemaker. That is, they may have a slow heart rhythm causing them symptoms. And if they require a pacemaker, they are given this option of having this leadless pacemaker. They should be at least 18 years of age. They should not have other contraindications as specified by the study. And then they should be willing to be monitored and come for follow-ups. And they'll have to go through informed consent, which are what we call as IRB, the Institutional Review Board. After they've gone through the informed consent, then Colleen Linda, our research coordinator, will help them get through the process of the study.
Can you talk about how exciting it is to have studies like this here in our community?
It is incredibly important for a community hospital like ours to be involved in these international research trials. That gives us access to newer technology, and it creates an environment where we practice evidence-based medicine. So it is vitally important for us to be part of the study, and especially Sarasota Memorial Hospital has an internal medicine residency program and possibly even a cardiology fellowship program down the road. So from looking at these aspects, it's vitally important that we be involved in all these international studies.
And how does this benefit the patients here in our community as well?
I think patients, if they have access to this new technology, they will be the first ones to be avail the positive aspects of this. And I think it will give them other alternatives rather than the traditional pacemakers, at least in this study. But apart from that, being involved in research helps them to get all the benefits of modern medicine.
Dr. Matthew, thank you so much for joining us today. And for more information about the clinical trials at Sarasota Memorial's Clinical Research Institute, please call 941-917-2225. And as always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.